You can keep your health care plan. You like your doctor, you like your plan, you can keep your doctor, you can keep your plan. If you like your health care plan, you will be able to keep your health care plan. Period. No one will take it away, no matter what.
Well, Mr. President, why are 7 million people about to lose theirs? Count Dr. Siegel? Not surprised. Hey, Doc, 7 million and counting, I think, right?
Eric, it's because the Congressional Budget Office said this week that the 3.5 million they thought were going to leave employer-based insurance over the next decade is actually 7 million. And you know what? It's probably a lot more than that for many reasons. First of all, employers can't afford these plans. They can't afford the idea that they have to cover families. The estimate out of the IRS is that it's going to be approximately $20,000 per person to cover a family of 5. People can't afford that. And also, Obamacare limits the amount you're allowed to pay into the plan. So an employer is going to say, wait a minute, the employee is not paying. They're limited to 9.5%. I can't cover that. I'm going to make them a part-time employee, or I'm going to pay the penalty. They're going to go to the exchange. That's what's going to happen to 7 million or more people. They're going to go to the exchange.
All right.
They go to the exchange, Eric, they get there, and they get into the affordability glitch, which is they can't afford the plans on the exchange.
But we wanted answers. Ed Henry asked Jay Carney, the president's spokesperson, about this, why the number keeps rising. Listen to what he said.
How can the president still claim that people are going to get to keep their coverage, keep their doctor, if 7 million people are going to be thrown off their insurance?
Well, I think that the report is oversimplified in a number of areas, and HHS can provide you more details, more information about that. The bottom line here is that no matter where you live, on January 1st, 2014, an insurance marketplace will be up and running, and consumers will have more access to quality, affordable health insurance coverage.
Carney said the CBO oversimplified it.
Isn't it interesting to say that, Eric? Oh, oversimplified. I read it. I read through what they're saying. They have every figure carefully conceived for the next decade, each year worked out. And they're impartial. You know, it's so convenient to say that when you don't agree with their results. And the fact of the matter is, not only won't you be able to keep your plan, Eric, but you don't get to keep your doctor. Because your doctor's not taking that insurance because he's moving to a hospital and going on a salary because he can't afford the fees being cut and all the expenses going up. So that is one of the most ridiculous statements the president ever made, that you get to keep your doctor. Now we're learning you don't get to keep your plan. You never could keep your doctor.
Yeah. It's not like we didn't talk about it for, I don't know, the better part of 2 years.
But the numbers are bearing us up now.
Right. Doc, we're going to have to leave it there. Dr. Mark Siegel,
Good
thank
to see
you so
Eric.
much. All right, amid all of this, the cost of the president's new health care law is also rising. The new estimate from the bipartisan CBO we just heard from, $1.3 trillion over 10 years, and that's up from $1.17 trillion just last August. And if former New York Lieutenant Governor Betsy McCaughey is right, it's about to go a lot higher. Betsy, thanks for joining us.
Thank you.
The numbers of people who are eliminated from that, who can't keep their own doctor, going up. The cost of this thing, skyrocketing.
Yes, let's put this in perspective, because over the last 2 weeks, 4 different government agencies, the Department of Labor, Health and Human Services, the IRS, and yesterday the Congressional Budget Office have all released new projections and new information that paints a very dismal picture for the future. The IRS has said the lowest cost family plan on the exchanges will cost $20,000 a year in 2016, and that plan will have big copays and deductibles when you finally go to the doctor. Secondly, the Department of Health and Human Services and the IRS unveiled a 73-page list of all the types of people who are going to be exempt from the penalty for not having insurance. They'll be exempt.
What is the penalty?
But they'll be
What's the
uninsured.
penalty?
It starts at $95 the first year, then it goes up to $295, and then
if it's that expensive, it's going to cost the family $20 grand to be on it. Why not just take the penalty?
because people want to have coverage for their family. They're worried about not having coverage for their children. But the fact is, more bad news. The IRS announced this week that people who get coverage at work, that's the way most people get it, but don't have family coverage, and very few will because of the cost now, their children will be ineligible for a subsidy on the health insurance exchange. So there will be millions of children who can't get insurance even though their parents have it. Finally, it was announced this week that many, many millions of people who thought they were going to be covered by Medicaid expansion won't be eligible for that either. All in all, it looks like $20,000 for a family plan and as many as 40,000 people, 40 million people, excuse me, will be uninsured in 2016. 40 million. That's only 9 million fewer people than before the law was passed.
Isn't that what this whole thing was? Is
That's
to get
right.
the whatever, 30,
Right.
40, or 50 million uninsured insured.
That's right. It's shocking that the CBO, Congressional Budget Office, got it wrong on so many fronts. They predicted that children would be covered under their parents' plan. Wrong. They predicted that
What is
people
this,
would be
Betsy?
covered
Let's take
under
a step
Medicaid.
back. What is this? What
Wrong.
do they want? What does the administration really want?
You know, my job is to know what's in here, and I never make political forecasts because I have no idea what they want. But I can
But
tell
are they
you one
driving
thing.
everyone to basically a government-mandated supplied insurance program?
Well, it appears that way, but I can tell you this. American people are already feeling the consequences. So many people are being called into their boss's office and saying, we're dropping coverage in October when these insurance exchanges are supposed to open. The Department of Labor, however, has announced that they may not open. They've already warned employers not to send out a letter alerting their employees as to these exchanges. They may not exist.
All right, Betsy, we're going to have to leave it there. Betsy McCoy, thank you. All right, home to the football champs.